We'll be looking at some of these topics in detail, but you can imagine for a sort of a 45-minute talk that we're just never going to cover all these sort of issues. But you can see that when an assessment is needed of somebody who's has injured themselves in a sporting activity, or they're fully involved in a sport, you need to look at things such as a pre-season, in-season, post-season. Weekend warrior, that's somebody who performs a sport only on the weekend, so they do nothing during the week, and then they really go too full out during the weekend. We're going to look at different sports. Is it an individual sport or a team sport? What is the level, national or school? Is it a strength sport? Is it an endurance sport? Is it a balance sport? What is the age of the sportsman or woman? Are we looking at a gentle type of exercise, or is it more endurance or agility, coordination? We'll go through these. Is it overtraining, undertraining? Is it the equipment? Is it the weather? Are there psychosocial issues? Are they anxious? Are there mood disturbances? Are they doubtful? Do they have depression? And how do they cope with stress? And how do they cope with injury? And are there other sort of comorbidities? Are they diabetic? Potentially, if they're an older female athlete, are there hormonal imbalances? How is their sleep? And how do they move? And what are their neurodynamics like? So these are the sort of things that we need to look at. And as you can imagine, in a short period for a talk, that's quite a big ask. So I've put my sort of top tips on assessment and rehabilitation into 10 points for you today. And the first one is know the sport. So you will always manage a sportsman better if you actually can understand that sport. So if you're involved with football or soccer, even if you don't play, read about it, watch it, and get involved. Know how many people are on the team, know the rules, some of the rules, know the kind of principles of the game, so that you can develop a trust with your athlete, and you can develop a rapport with him, so he or she believes that you understand where they're coming from. And if you need to develop a bond with that athlete, and an athlete or a sportsman will always gravitate or go to health practitioners who understand their sport. So try and understand their sport, and you'll get much better trust from that athlete and better buy-in from them. So get to understand the athlete in front of you. So before you start to say, why are you here, or what is the problem, get a feel for what their goals are, what their ambitions are. What is the level of competition? Maybe they just want to be able to play with their friends at school. Maybe they want to make an international team. Maybe, so it's so variable in that for that individual. What position in the team do they play? So if they are an offensive player, so if they're playing football, are they playing at the front? They're a goal scorer, or are they a defender? Because you get different personality types. So your offensive players are far more aggressive A-type sort of people, and your defenders are far more introverted and quiet. And so again, that gives you an indication of their personality and how you will manage them. What is it? Are you going to be managing them pre-season, so before the season starts? In season, we'll talk about the complications of treating somebody while they're still competing. Or is it after the season, when they can rest and you can do more rehabilitation? And what is their emotional and financial support? Is the manager of the team supportive? Are their parents supportive? Can they afford the treatment with you? Is somebody assisting them financially, such as the team or the international body, or are they going to have to pay for the treatment themselves? And all of these kind of things are important. What are their psychosocial factors, their fears, as we've discussed, anxieties and depressions, and emotional components that might affect your treatment of that athlete? So once you've developed a rapport and a trust with that athlete, so you've chatted to them for about 5 minutes or so, now you want to conduct a thorough and detailed subjective assessment or interview. Now this is really important, because if you assess somebody or treat somebody and just say, what is the problem, without conducting a good interview and an objective assessment, most likely you're going to miss the cause of the problem. So you'll end up treating the site of the problem and not the source of the problem. It's really important that you are very clear on this, and that by the end of the subjective, you can visualize the problem that that patient has come to you with. So I always say that the interview or the subjective assessment is a bit like playing chess. And so at the end of the interview, all the chess pieces should be on the correct position on the board. Otherwise, you can't play the game. So it's really important that you perform a good subjective assessment. And as I've said earlier here now, you need a careful and accurate history taking. It really is crucial, because if you can't find it in the history, how are you ever going to treat it? So for better outcomes, you've really got to, and patient-centered care, you've really got to do a very good, accurate assessment. So you need to know if it's a traumatic injury, such as a tackle or a fall off their bicycle, or if it's a slow buildup or a history of overload. So has this, say they're starting to run and train for a marathon, has this come because they've increased their trainings too soon? So you need to understand the loading history. And for this also, you need an exact mechanism of injury. So what I like to do is get a demonstration from the sportsman as to exactly how it happened. And is this an acute injury? Is it subacute? Is it chronic, or is it persistent? So persistent means that it niggles and that the injury settles and then it comes back again. Or it just keeps on happening again and again and again. Do they have pain at rest or pain at night? And so all of these are very important things that you need to ask. You need to be very careful with your pain distribution. And I like to use a body chart, and you need to be very specific. You need to investigate things such as hypermobility, instability, and locking at that specific area, such as a recurrent dislocating shoulder, maybe locking at the knee, and instability at the ankle with frequent lateral ligament sprains, for example. And you need to assess what we call our yellow flags. So things you need to assess their self-esteem, their anxiety. Are they angry? Are they frustrated? What are their coping strategies? Do they have avoidance behavior, which means that they go, oh, I really don't want to run, so I'm not going to. I'm going to rather sit this out. Or I know that if I throw, my shoulder's going to be sore, so I just don't throw. And so sometimes the fear of pain can be worse than the pain itself. Sometimes these avoidance behaviors can actually be very damaging. And what are their beliefs about pain? Do they believe that the pain is going to, that if they're in pain is going to cause more injury? Maybe it will, maybe it won't. And these are the type of things you need to assess. For your special questions, for example, have they had quinolone antibiotics in the last 6 months? And often tendon injuries, tendons can rupture if people that are susceptible to quinolone antibiotics. So often you'll see Achilles tendon ruptures with guys that run within 6 months of taking a quinolone antibiotic. So that might be predisposing the injury that's presenting in front of you. It's an important question to ask if they have been on quinolone antibiotics, and they're very common antibiotics because they can be used for, I don't know why they're swapped. They can be used for things such as upper respiratory tract infections, lower respiratory tract, GIT or gut irritations, drugs such as Ciprobe, Taravid, and those sort of antibiotics have a predisposition for rupturing the tendon if it's overloaded in that group of people that are susceptible to those antibiotics. It also means that those people respond much more slowly to treatment because of that underlying susceptibility. And the half-life of those antibiotics, quinolones, is 6 months to a year. So those people are predisposed to tendon injuries within that period of taking that antibiotic. Are they on antidepressants? Because that will give you an indication of their psychosocial status. Are they on drugs such as Crestor, which can increase stiffness, or Reacutan, which young people take for the skin, which can cause a lot of muscle spasm? and what sort of investigations have they had done to date, and try and get those reports and file them and make sure that you've got those in detail. Comorbidities, diabetes, for example, can increase the incidence of frozen shoulder or tennis elbow, for example. Obviously, underlying things such as COPD can cause respiratory issues, and respiratory issues can also cause changes in your pH, which creates hypocapnia, and that can cause muscle stiffness and nervous system disorders. Rheumatoid arthritis as an underlying can obviously affect your musculoskeletal system. Sleep hygiene. So really we need 7 to 8 hours sleep a night, and we have to make sure that those people are getting that. And if they're not, that again might be a reason why the condition is not settling. So get all the reports, get the op report, get an isokinetic report, and I always file absolutely everything. So I become the Minister of Administration, so I can actually control all the information, and I make sure I understand exactly what I'm dealing with here. So I'm putting my pieces on the chessboard in the right place. And when I finish my subjective or interview with that sportsman, my last question is there anything else you'd like to tell me? Because often they've forgotten. And what I'm hoping that they say to me is, wow, this is the most thorough assessment that I've ever had. And that's what you're kind of looking for. Because then, you know, even if they've forgotten something, you've done the best that you can to get as much information as possible.